international airports were not functioning. So that became the problem, to say, because it's not the first time that we have lost a student in Cuba over the years. There was one who passed away even last year, and there were no issues because the flights were operational, everything was done, paperwork done, and the body of the student was repatriated. Now the problem here, which we've been sitting with, is that there are no flights, both domestically and internationally. And that became the headache as to how do we move. We discussed it with the Eastern Cape Province, MEC, where the student comes from. And I saw on the news that they did say that the MEC wrote to them, giving them an option of either a burial in Cuba or a cremation. That was really a practical proposal in terms of the situation in which we are stuck now. So we've been working with DERCO, our Department of International Relations and Cooperation, to look at various ways in which the body could be repatriated. And up to this stage, we just couldn't find a flight.
Ndare Phaahla, what of the many repatriations that we have seen over the past weeks of South Africans who have been stuck in a number of countries abroad? They've been successfully brought back home. Does it work differently when a person is deceased?
Not necessarily. If there was a repatriation from Cuba to Johannesburg to South Africa, we could have made use of such an aircraft. As you can see, in quite unfortunate actually that by the time when there was an aircraft which went to collect the Cuban doctors who came to South Africa, when this death of Sibusiso happened, that had already happened. The aircraft to collect the Cuban doctors had already come back to South Africa. So in all those cases, Department of International Relations works with South Africans who are stuck elsewhere in the world, and preparations, are made sometime together with the countries where the South Africans are stuck. In some cases, the aircrafts which have been used have been those which have been chartered by the other country, like in the UK. The UK, for instance, as far as I remember, chartered an SAA flight to bring British citizens back to the UK, and in so doing, South Africans who were in the UK were also able to come back home. So it's those kind of situations now. At this stage, as you'd be aware, ever since the aircraft which brought the Cuban doctors, there's never been any other aircraft. Unfortunately, unlike other places in the US, in Europe, you don't have many South Africans except the students who are actually in Cuba. So there's been no other South African citizens after the chartering of bringing the Cuban doctors. There's not been any other aircraft from Havana to South Africa.
You rightfully mentioned that the family was given the option to either cremate the body or to bury Sibusiso in Cuba, but they also allege that they were told that it will be quite expensive and costly to undertake this process. What is the cost of repatriating a body?
No, the cost is usually manageable. As I said to you, even last year there was a Limpopo student who passed away. It was normal international passenger aircraft, which also then you make, there's a particular arrangement, applications to transport human remains. There's particular systems which you need to follow, approvals, and I can tell you even now as we speak, that part has been done with the Cuban authorities. The approvals to transport the body once there's an aircraft which is coming to South Africa. Now, so that is the kind of cost which is slightly above transporting a live passenger, possibly about twice. I speak under correction, but from what I have learned, normally it would be almost like twice what it costs to bring a live person. But that is normal passenger aircrafts or normal cargo aircrafts. Now, in this case, the difficulty is that because most of the time, the travel from Cuba to South Africa is via Europe, most of the time via Paris. Now, there are no regular passenger or cargo flights. So that's what the only option then which remains is to charter an aircraft, which will then go to Cuba. Now, that is a couple of millions. I mean, when we bring, the last time we brought students, I'm not sure how much the doctors one cost. I think it's about 8 million. I know the last year when we brought about 600 and something students, we chartered from SAA 3 aircrafts. Each one of them was costing about 10 million rand. Now, I don't know if it's a smaller aircraft. I mean, this is a long haul. So your ordinary smaller aircrafts wouldn't do. There are all sorts of requirements if you're going to do across the Atlantic Ocean. So it would be, 10 to 12 million was what it cost us to bring about 200 passengers at that time. So I don't know if there's any other different, but it will be nothing less than a couple of millions if you have to charter an aircraft specific.
You mentioned that the challenge now is finding a flight. What sort of reassurance can you give the family in terms of when they can expect the body to be repatriated back?
Dudu, between me and you, we know that this is an international crisis. There are no international airlines moving between countries. I don't know. I mean, if I knew, who knows when the virus is going to be reducing? When will, British Airways is grounded, Air France is grounded, Virgin Atlantic is grounded. I don't know when those aircrafts are going to pick up to the sky. So that's just the reality. I can't say to the family, international aviation is going to resume in 2 weeks, in 3 weeks. I don't know.
Fair enough. If I can please take this opportunity to get your reaction. We understand that AfriForum has successfully applied to the courts, and the courts has granted that people can self-quarantine from home when they do find out they have COVID-19. Your reaction to that?
Well, I don't even understand why AfriForum had to go to court to get that, because that's our policy. That's our policy in terms of dealing with COVID-19. Firstly, let me just take you backwards in terms of our system. If you are a contact of a positive, somebody who has tested positive, you have to self-isolate in your own facility if you can. If not, then we can offer a facility where you can be quarantined while waiting for the results as a contact. Once you test positive, now it depends on the doctor. It's between the patient and the doctor and health department as a supervisor. If as a patient you test positive, but you have got no symptoms, it's simply that you are a contact, and then you have also tested positive, or you have very, very mild symptoms, and you have good facilities to can stay alone at home and not interact with other family members and friends, and be able to have your own ablution facilities, bathroom facilities, dining facilities, then we are happy with that, as long as you are not having any major symptoms. And there are people who have recovered, finished 14 days, recovered, end up with no symptoms without seeing a hospital. But the doctor has to be supervising, so that immediately you develop symptoms which are worrying, to say you may become serious, then you must be taken to hospital. So that is basically our policy. But on the other hand, if it is clear that within your home circumstances there is no way in which you can self-isolate at home, because there's no way you can have your own room, your own ablution, your own dining, and no interaction with the rest of family, then we have to assist you to get you, even if you're not having serious symptoms, into an isolation facility which is operated by the health department. So I don't even understand why AfriForum had to go to court, because that's how we operate.
Phaahla is the Deputy Health Minister. Thank you very much, sir, for your time this afternoon.